If you were to fast forward and look at the impact of COVID over the next 3 to 6 months, I would say that we are at the point where the humanitarian crisis is really kicking in, and it doesn't look good. It's actually going to get a lot worse.
The pandemic is going to be much more than just an immediate medical crisis for the poor, especially in low-income countries. It will be more of a long-term tidal wave of combined threats that people will really struggle to cope with.
We have a health crisis, primarily COVID, but there are other health crises unfolding. We have an economic crisis, and we have a governance crisis, including conflicts.
And with the pandemic comes in additional challenges of market closure, of movement restrictions.
Farmers have limited areas to sell, but also they are selling their crops at a loss.
COVID is actually sort of like a magnifying glass, if you like, of the world's inequalities, exposing a lot of those underlying issues more than we've had so far.
What we are anticipating is a substantial increase in malnutrition, particularly affecting the poorest people, particularly affecting the children that we work with.
Every study you see on the impacts, the long-term impacts of malnutrition on livelihoods and on intergenerational equity always start with some kind of shock. And here we have the mother of all shocks.
We are in the hunger season at the moment, so the situation is only going to get worse. And if we don't continue investing in these areas or expanding our level of support, we are likely to see an increase in the numbers of people that are chronically food insecure, a deepening in the levels of hunger in this region.
There's a huge risk and danger that the developmental gains that have been obtained in the past years would be lost during this time, because households would be fighting economic hardships that they'll be getting through selling household assets.
There's the international element, which is the collapse in commodity exports, the collapse in employment related to that, related in the African case also to travel and tourism, the collapse in remittances, the collapse in tax revenues.
People have been suffering from loss of income and livelihoods and loss of jobs at different sectors at different levels. The health system of Bangladesh, which was already very fragile previous to COVID, this health system is now facing significant strain.
We have to go on addressing wide needs, not just deep COVID disease or caseload needs. We have to keep the balanced portfolio, and we have to work on existing poverty and existing vulnerability.
There's a real danger that governments will use the opportunity of COVID to cut back on funding for the poorest countries in the world, and it's a false choice.
I think keeping that focus amidst all this is important, that we don't go back or we don't erode the gains that have been made thus far.
There are choices we can make now to also accelerate positive trends, whether it's localization of humanitarian action. Last few months I've seen fantastic new remote solutions and virtual tools being applied to humanitarian action for the first time.
The good news is there are trained aid workers on the ground, responding, staying, delivering. They know what to do. They simply need to be supported.